So what we see is that the intakes of vitamin K, the daily requirements aren't very high. They're not excessively high, but there are some particularities that can lead us to be in deficit or deficiency. The lack of natural sources, the absence of gut health, the alteration of the microbiota, and then a peripheral environment that doesn't direct blood flow to the bones, that doesn't direct resources to the bones, can ultimately lead to disorders at the bone level. And notice what I mentioned earlier. Vitamin K deficiency can lead to a wide range of symptoms, from osteopenia and osteoporosis, to increased susceptibility to bone fractures or difficulty in blood clotting. So we see that the range of symptoms that may be related to osteoporosis is very large. And here's the whole focus of this guy, who I think does impressive work, Bruce Eames, where he talks about how when a substance regulates multiple functions and there's a deficit of that substance, the availability of that substance is ensured to fulfill the most vital functions. But those functions that have evolved later on will start to be deprived. So when we talk about vitamin K, notice that vitamin K is essential for the brain and is crucial, for example, for supporting the functioning of the prefrontal lobes, which we use to build thoughts and to philosophize. But that's a function that vitamin K acquired later on, probably much later than the first functions it had in evolution, like supporting metabolism, maintaining mitochondrial activity, or ensuring blood coagulation. So when we talk about vitamin K, look, vitamin K is essential for the brain and is fundamental. For example, to sustain the functioning of the prefrontal lobes, with which we dedicate ourselves to constructing thoughts and philosophizing. But that's a function that vitamin K acquired. Metabolism, mitochondrial activity, blood coagulation. In patients with coagulation or mitochondrial issues, consider significant vitamin K deficiency. The liver is the main organ for vitamin K. So logically, a relative deficiency of vitamin K isn't going to cause disorders at this level. It might cause issues at other levels. But when we see a patient with coagulation problems or chronic difficulties in activating their mitochondrial activity, we need to consider that a vitamin K deficiency could be much more significant. And here we have an organ, a fundamental organ that is the homing organ for vitamin K, which is the liver. It's the liver. In other words, of course, the entire coagulation system depends on or is reliant on the activation at the liver level of a whole series of proteins that perform that coagulation function. So the entire process of vitamin K absorption, which mainly comes from food consumption, starts with the liver as the first organ to receive it. The liver uses vitamin K, but doesn't release it into the bloodstream if there's insufficient vitamin K for its functions. Similarly, vitamin K is produced by the gut microbiome, absorbed by the cava system, and reaches the liver. The liver uses what it needs and circulates the rest. The bone is not the first to access this micronutrient because the liver prioritizes its needs. And something similar happens with vitamin K, meaning it's produced by the gut microbiome, it's absorbed by the cava system, and then it reaches the liver. From there, the liver uses what it needs and then releases the necessary amount into circulation. Then we see that the bone is probably not one of the first organs or tissues to access this micronutrient profile, because there are many other organs, and the first of them is the liver, which will primarily keep all the vitamin K it might need at any given moment. So what do we see? Nowadays, in our daily lives, we accumulate many risk factors that can certainly and undoubtedly be associated with vitamin K deficiency. Many of them are pathologies in themselves, where physiology is already significantly altered, but many of them are factors closely linked to lifestyle, chronic immune activity, all the pathologies associated with low-grade chronic inflammatory processes, malnutrition, alcoholism, absorption issues, and then, of course, numerous pathologies that can at some point lead to these types of deficiencies. Another element that has a big influence on bone health is stress, whatever that stress may be for each person, because it's not so much the stress itself that causes bone damage, but rather the response we give to that stressful situation. And what we see is that this excess of glucocorticoids ends up signaling to the bone and in a way activates transcription pathways that stimulate the osteoclast, which is the cell that primarily reabsorbs bone tissue. So, as I mentioned at the beginning, the context of chronic and prolonged stress also puts a lot of pressure on the bone tissue. So, inflammation on one side, stress on the other side, and the difficulty for the bone to maintain itself. Another substance that is also essential for bone health, because it regulates the ability to carboxylate osteocalcin, is vitamin D. This is another vitamin whose deficiency in the current population could be considered pandemic, and it's a very ancient vitamin in evolutionary terms, with many assigned functions. Its deficiency can lead to symptoms that are very mild, let's say, or have very little impact on health, to symptoms that at some point could have much more significant implications for health. They have a huge influence on metabolism, a huge influence on immunology, and they also have a huge influence on bone formation. And it's another vitamin whose deficiency can occur throughout a person's life cycle and will always have implications for health, regardless of whether the deficiency appears in childhood, adolescence, adulthood, or later in life. Whenever it occurs, it will have implications for health. What we need to understand is what the main risk factors are at each moment of the life cycle to try to keep track of the status of this vitamin. And once again, we find that a significant part of all the vitamin D we see in the bloodstream is closely related to absorption at the intestinal level and the consumption of foods rich in vitamin D. Although we know that just eating foods is not enough to maintain adequate levels of vitamin D, solar exposure is also necessary. So, once again, we see that this significant part means that when the intestine is not functioning well and the bacterial flora is in poor condition, the availability of vitamin D will also be compromised. That's why when we see vitamin D deficiencies, we need to ask ourselves what risk factors might be present that could lead to insufficient vitamin D. Can there be deficiencies in the diet? Yes. Could there be a deficiency in terms of sun exposure? Also, there can be absorption disorders, and there can also be metabolic disorders that make it difficult to absorb and release vitamin D. There can also be a pancreas that isn't able to facilitate the absorption processes of fat-soluble vitamins, where vitamin D plays an important role, as well as vitamin A and vitamin K. In other words, we need to broaden our focus again to understand this deficiency, which, as I mentioned earlier, is practically pandemic. When we look at the epidemiology of vitamin D deficiency, we see that it practically affects any age group.